Hello, students. This talk is to tell you about the bone structure and mainly to reemphasize how dynamic this structure is. Normally, when we talk about the bone, we think it's a very dry structure which is non-active. But if you dig deep into bone, there are many secrets of it, which some of those secrets we know, and some we're still grappling with. But one thing is clear that it's a very dynamic structure and very versatile structure, and we will know about this part of this bone. So the beauty of the bone as a very strong structural supporting structure is both in its content and the way it's organized. The lamellas, which are organized in cortex in a different way than in a cancellous bone, and the content of this tissue, which bone is a specialized connective tissue consisting of cells and matrix, and especially the matrix consisting of two very important components. One is organic, which is collagen 1, and the other one is inorganic, which is mainly calcium phosphates, which is a type of hydroxyapatite calcium phosphates. And these two metrics content of the bone give it a unique advantage of dealing with all the stresses, the inorganic for the compressive stresses and the organic for the tensile stresses. One has got very strong stiffness and one is very ductile material. And together, this composite material is very useful in supporting the structure to the different stresses puts on this. So this is the beauty of its content. What about the structures? The organization of the bone in such a way that is a hollow tubular structure for the important long bones where weight is being supported is engineering-wise a very great advantage. But if you produce a substance which is much, much stiffer than bone and much, much stronger, even if you increase its diameter, even those structures keep on failing if you live long enough. Whereas bone, you can live up to 90, 100 years of life. So what's the difference between that the bone can last and these strong material, both in their content-wise and material-wise and the structure-wise, are not lasting that longer? And for that, we need to understand this dynamism of the bone, which is continuing throughout your life. So let us dig a bit deep into this and understand how bone is formed, how it is modeled, and then how it continuously remodeling throughout your life. As far as the formation of the bone is concerned, and this will be a detailed talk separately, but essentially, the two ways bone is formed. One is a mesenchymal stem cell condenses to form either a template for the bone, which later on get converted into a cartilage template, and then the cartilage template become a bony structure. Whereas the other way to form it is that directly this condensation changes into bone. And these are the two ways bone is formed. One is called enchondral ossification and one is called intramembranous ossification.